You're watching PCTV Channel 17, proudly serving the Port Clinton City School District community. The following is a production of the Port Clinton High School Digital Media class.
Welcome to Time for Health. I'm your host, Rachel Fall, and we're very glad you've joined us. We hope you gain something from the program that helps you and your loved ones. We want to arm everyone with as much information as possible so we can all make good choices. This is not to take the place of regular medical care, so be sure to include your healthcare provider in on your plans and your conversations. And today we have two guests, John and Jackie from the pharmacy at Magruder. Thank you for being here.
You're welcome.
Yes, you're welcome.
Your first time, maybe not your last, so I appreciate you taking the time to be here. We're talking about pharmacy. We're talking about all different kinds of things related to pharmaceuticals. And the reason we do this is because in the middle of October, there's a whole week that's Pharmacy Week. And so medications play such an important role in so many different areas. So we thought we'd do an episode. So whenever I talk to a pharmacist, one of the biggest things they talk about is having your medications on a list. So talk about how to do that and why it's so important.
Yeah, it's important today because everybody in our society really uses medications, whether we're young and old. And we've got so many more medications today, Rachel, than we've ever had in our lifetime. So when we look at the medications, how they interact in our body, when we're young, we're wet and we're like a grape, and we're old, we're like a raisin. So if as medications throughout our lifetime change and how they work on us. So it's important to let your healthcare professionals know what you're taking, nutritionals, vitamins, and all your medications. We never know when that traumatic event will occur, when we end up in an ambulance or in a hospital. So it's really important. You can get medication lists from your local pharmacy.
Sure.
You can create your own list. You can download them from the website. But the number one thing you can do to help the healthcare professionals who are helping you is to have an accurate list. We never want to take more than we need to. We want to make sure we take the right doses we have, and without that, we really tie the hands of those who are trying to help us.
Who are trying to take care of us. So every time a dose change, you go to your doctor and he ups it or lowers it or whatever, you want people to
absolutely
edit that list.
We encourage you to use pencil when you create the list, so you can erase and put the new dose down twice a day versus 3 times a day, or create a new one. But yep, the more accurate you can keep that and up to date, the better off it will be when you need it.
And you mentioned it can be like a printout list. It could be that.
You can go to your local pharmacy. They can give you a current list, on a quarterly basis. Say, hey, can you print me my medication list? You can come to Magruder Hospital. We'll be more than happy to give you a list to create yourself, or you can just go onto your computer and type it up on Microsoft Word.
Scratch it out, edit, scratch
Absolutely.
it. Doesn't matter. It doesn't have to be pretty.
Yes,
it just has to be accurate.
Yep. And try to date it so the professional who takes it does know how recent your last update was.
Okay. And you mentioned vitamins, herbals, over the counter, all that stuff as well?
Yeah, there are many things that interact with drugs. There are many of our drugs come from natural products. And there are many things available from around the world that people take through buying on the internet. So it's important for us to go out there and try to look and identify that maybe a certain side effect or problem in our body today could be either the interaction of 2 of the medications, or an herbal plus a medication, or just the herbal that you were taking, fillers or something that was in it could be causing trouble. So it's good to list those so we can try to diagnose and figure out what might be the underlying problem.
That, and so that there's not any duplication in therapy as well when you go in.
Okay. So
Absolutely.
your doctor might order something. Oh,
Yep.
It's already on here. Okay.
All right, you're already taking it.
So the other thing that is often mentioned is very important is how you store your medications. I've heard that the medication cabinet in your bathroom is actually not a good idea.
No, it really isn't. Only because everybody has access to it when they come into your house. Your guests, kids. It's very important to keep them up and away and in a secure location. So in your bedroom, again, up away from smaller children is very important. Very
and that's
important.
probably, is that true? I mean, even if you just take a multivitamin or whatever?
Yes,
no matter
absolutely, absolutely.
Okay. What about mail order? They're not stored in your mailbox or your front step, but do you have to take extra precautions for that kind of stuff as well?
Yes, generally speaking, they will send it to you how it needs to be stored. So if it's a refrigerated item, they'll send it to you in a refrigerated tote. But it's very important to go and get it in a timely fashion. So once you order it, you typically know how long it will take. Magruder's Pharmacy also offers delivery service too, so people can take advantage of that.
You don't want it sitting out on your front step.
Exactly.
For a lot of reasons, the access reason and the temperature reason as well.
Exactly.
Okay. Any other thoughts on storage? Or?
Yeah, the other thought around the mail order is many of our medications are very expensive, and we see all the time where people grab the boxes out of people's mailboxes, especially this time of the year, buying Christmas presents. So you got $1,000 worth of medication sitting in your mailbox, regardless of whether it needs to be refrigerated or not. If they come up missing, it can really be a significant impact to your pocket as well. So there are some issues.
Plus the delay in therapy as well.
Right.
Very
so
significant.
making if you know you're not going to be home, like you said, they'll usually tell you when it's coming. If you know you're not going to be home, to ask a family
neighbor,
member, somebody that you trust. To do that. Okay. Timely, as of the taping of this show, we're coming into flu season, and usually it's a nurse. It can also be a pharmacist who kind of gives the vaccine, but it's actually a medication. It's a vaccine. So talk about. It could be a whole episode, I know.
Yep.
Try to.
Flu season is approaching. October is the month to get your flu shot. We don't want to get any sooner than October, but if that's the only time you're going to be in the physician's office or in a pharmacy, we encourage you to get the flu shot. Typically, less than 50% of the population, Rachel, actually get immunizations. And the sad part is about 45,000 adults die a year from a preventable disease, and about 1,000 kids a year die from a preventable disease from immunizations. Last year, pharmacists gave about 20% of the flu shots, whether you get it at your physician's office, at a clinic, at a big box store, or at your local pharmacy. But we really encourage you to get them. There's last year, I think, on 25 million doses of the flu shot, there was only 33 true allergic reactions. So they're really very safe.
Wow,
most of the reactions are very minor. Arm pain, a little bit of local redness, that kind of stuff. So we really encourage you to get your flu shot.
It's actually also a myth that you get the flu from your flu shot. So definitely don't be swayed by that.
We had on the back of one of the flyers that we use is a lot of frequently asked questions, and that's it, because I have heard a lot of people say, well, I had vomiting and diarrhea afterwards. Well, that's not actually the influenza flu. That's stomach flu, but that's not what the vaccine is for. So you don't have any control over that.
There's a several-day incubation period. So if you do get the flu shot takes about 2 weeks to ramp up. You could have been exposed to the flu virus prior to the time that you got your flu shot. So people say, oh, I got sick 2 days after. Well, you likely had the virus before you ever got got any prevention. Flu shot takes, again, several weeks to really ramp up and last for 3-4 months. The peak flu season for our part of the country is typically late January, February, and March. So we want to have our shot before then. So if it didn't get it in October, to get it in November or December is still okay. We want to prevent that.
It's always a lot later than I would think.
Than you think,
think.
But that's it's a much delayed season than we think here. But we talk about it in the fall because we want people to get immunized. We want to get immunized ourselves. We found out that those who get immunized, if they do get the flu, they get it less severe. And we're less likely to give it to people around us. The elderly who are at risk for dying from the flu, or the extreme young, or the immunocompromised, those with cancer, or had other medications or things to weaken their immune system. So it's good for us even if we're otherwise healthy, so we don't give it to somebody else.
So somebody can die from the flu. You mentioned there's adults and there are children who die from complications from the flu.
That's absolutely correct.
And it is fairly preventable. Now there are strains, that's probably a bit too scientific to talk too much about, but there are strains that...
Yeah, there are, you'll hear talk about the trivalent and quadrivalent immunizations. There are the immunizations, there are basically two types. There's a trivalent and a quadrivalent. In the trivalent there are 2A and 1B, and in the 2 A strains, and A strains, only adults get the A strains, and kids get the B strains. So the trivalent has 2B and 1A, so the adult doesn't necessarily need a trivalent because there's only one A in it. But so as adults, we would want a quadrivalent, but it doesn't hurt to get a trivalent or quadrivalent, you know, for either. The kids definitely need to have both B strains.
Okay. And I know when we do our clinics, some people have asked about, do we do children at our clinics, and we've kind of taken the stance that we only do adults because if I remember with my own kids, they need like 2 shots, and that's a discussion with your family doctor. You need to figure that out. They need 2, I don't know what, but kids, talk to your doctor.
Yes.
Or the parents.
Yes.
We're just talking flu here, and flu we need one every year.
Yes.
Okay, good deal. And that is something, flu is something that you would get every year versus like
That's
a
correct.
pneumonia shot.
Pneumonia about every 5 years.
Yep.
And then the Zostra about every, you know, a once in a lifetime, right?
Sure. And there are, I know the ones that we use at the flu shot clinics, there's single dose vials and there's multi-dose vials and all different kinds of variations.
Here we only use single to prevent that. There was some news last year about clinics using multi-dose vials, and with Magruder we only use single use.
Yeah, because are there preservatives or something in it that sometimes people think they've had a reaction to the flu shot, and it's more
in the multi-dose, and there's not in the single dose ones.
But, and a lot of this is probably too much. You can tell I help with the flu shot clinics. I know just enough to be dangerous. It's probably too much information, but you know, it's a conversation with your doctor. It is so widely available.
Correct.
Yes.
There's really,
and that's why it is so widely available, because we know it helps save lives and save dollars in the workplace, and it's always better to prevent the disease rather than trying to treat it after the fact with some of the medications that are there.
Who wants
very
to be
expensive,
miserable?
and they don't really, you know. So the real goal is to prevent it and not try to treat it.
And that's one of the ways you can do it. And washing your hands. But that, again, that's a whole other episode as well. Any other thoughts on flu shots? Anything you want people to know about?
Get them.
Get them.
No matter when it is,
and
get
we can bill your insurance for them too.
Right. A lot of insurances do pay it. Yep, you're right.
Yep.
So that shouldn't be a consideration. All right, we're going to use this opportunity. We're going to take a quick break, and we will be right back. Talking about pharmacy. It's going to be Pharmacy Week in the middle of October. We talked a little bit about flu shots, which again could probably be its whole own episode. But one of the other topics I kind of just wanted to bring up, and if that really could be its own episode, is the opiate issue that we have going on. I don't even know. I'm sure I learned somewhere in a college class technically what an opiate is, but like, what's the path? How does this all tend to come about from a pharmaceutical standpoint?
Yeah, you know, I think the pain medications have really served a great purpose throughout, you know, for many people. After surgery, we have chronic pain, we have certain conditions that we can't, surgically repair, so we have to be on medications chronically. But there's also a subpopulation who find that there's a beneficial effect from taking that medication and relieving the pressures of day-to-day life. So there's a lot of reasons. So I think as we look at the opioid addiction and the epidemic that we have today, you know, I think we really see that the federal government and the state governments are really, and the medical community is really banded together to try to do, I think, the best job we can to try to, one, those who have became addicted, helping those out, and then trying to make better choices in terms of how we treat people with either short or long-term pain. You know, as we look at the process to get to addiction, you know, it starts off at, just experimentation, whether it be with alcohol or drugs or whatever it may be, and then from there it goes to the phase of regular use, and then it progresses to a potential phase where it disrupts our daily life. You know, I'm not as productive at home, at work, whatever it may be. Then we get into the psychological addiction to where I feel I can't get by without it. And then finally the physical, our body really craves it and needs it. So those are the basic stages of addiction, and whether it be alcohol, whether it be the Valium or Xanax types of drugs, or whether it be the opiates, the true narcotics, the Norcos, the hydrocodone, the oxycodones, and or heroin. They're all about the same. If we look at last year, I think the State Highway Patrol, I think all of last year only seized about 18,000 grams of heroin. And I think the first 6 months of 2016, they've already seized over 50,000 grams of heroin. So really, it's on the increase. So we see all the limitations that we're putting on physicians through the DEA and through the states in terms of limiting the use of the prescription narcotics. So we see that starting to fall. But we see fentanyl was a very potent acting agent, and heroin really spiking up. So the black
when
market
you're
of those
addicted, you'll find.
You'll find. And heroin is the cheaper alternative of some of those that are out there.
I didn't realize somebody was saying it's cheaper to get heroin than to, I don't know, some
It is.
prescription or whatever. And
Unfortunately.
Unfortunate. So that, I mean, that's how it's from your body, you get pain relief, which is good. That's why your doctor prescribed it. But then after you just kind of maybe take it beyond what you're supposed to take
and then your body needs it. And then when you start to take it away, your body reacts and you feel like crap. And then you want to refeed it. Yeah.
Okay.
So.
And that's how it kind of leads to.
Correct.
And they're going from something that's prescribed and tested and regulated. And when they don't have that anymore, then they're getting into the illegal substances, which obviously are not regulated, and
and we don't know what's in them.
What's
That's what makes them so dangerous, is that you don't know if you're going to get just that one drug, or as in several outbreaks over towards Cleveland, they actually had heroin laced with fentanyl. So you can imagine, what those people went through.
That's not obviously a regulated substance, and so.
And as you see, one of the methods that the state has done, and really the country, is making Narcan available without a prescription, and make it much more readily available to be able to treat, just like your healthcare response team can give the Narcan, can be given in a home to prevent that death from occurring.
Okay. So that's a medication that can reverse an overdose, theoretically, or
sure does.
It does, but it's very short acting. So if by chance someone does happen to use it, it's extremely important to go to your ER, call 911, because the person can relapse back into a coma.
The narcotic lasts much longer than the effects of that naloxone. So boom, I take it within minutes, I'm back again, but then all of a sudden 15, 20 minutes later I fall back into the same coma.
That's why you hear so many news stories about people getting more than one dose. That's why.
I have heard that. Very good.
I know.
Every day. So one of the things that's kind of tied into this addiction issue and the whole storage and access is getting rid of your medications. If you're on a pain medicine or any medicine, your Flintstone vitamins or whatever, and you're not using them anymore, or they're expired.
Don't just give them away. Don't just give them to a friend.
My neighbor, don't you need that?
Don't do that.
Yeah.
Here in Ottawa County, we have several drop-off locations. And they are all affiliated with either a police department, sheriff's office. If you have any questions, call your local police department. They will be more than helpful. They'll explain to you what you need to do. The one thing that we recommend is blacking out your information on your bottle before you take it, so that your private health information is protected. And just take it to your local police department, sheriff's office.
And I think in Ottawa County, I think they even do the controlled substances and whatever you got, just get rid of it.
The recommendations now are actually to take it to law enforcement. There's been a lot of stuff with the EPA and protecting the water supply, so they would actually prefer you to take them there now.
This was probably a year or two ago, I heard somebody joking about so many people taking pain medicines, and people, historically, you just flush them or pitch them. And I heard somebody joking, well, that's why the fish aren't biting, because all these pain meds and anti-anxiety meds are in the water, and the fish are just happy floating around. So we are very lucky, I know, in Ottawa
Yes.
County. We pass out information as much as possible. There are four, and we take
And
advantage
you
of it.
can call
too.
your pharmacy too. They'll direct you to
Right.
a local, the closest drop-off point.
Because a
as
lot
well.
of people save it for, well, I might need, I might be prescribed this medication later, or I might want to take, but
Which
if you don't use
again
it,
can loop you right back into that addiction because
Right.
your doctor doesn't know that you're taking it. Why are you taking it?
Right.
Whether
whether it's a controlled or not controlled substance, if you're not prescribed it, get rid of it.
exactly.
Right?
There are so many, missed drug adventures in life. If we can help prevent just a few of those, that's what our aim is to do. So
Right.
yeah, anytime we can get rid of those medications, potentially decrease an erroneous overdose or a bad outcome, that's what we in the healthcare
Right.
profession would like to do.
And I've heard, I've gotten calls at the hospital where people say, somebody passed away, or I got a mail order, so I got 90-day supply, and then the doctor changed the dose, and so I have this, can I donate it? But
No.
people don't do that.
No.
No, no,
you
and
don't know.
we can't even take back medication once patients come to pick it up
Right.
from the pharmacy. Pharmacies won't take it back because you don't know where it's been, what's happened
How
to
it was
it.
stored.
There are
Correct.
some drug repositories throughout the state of
Sure.
Ohio, and I think there's one in Sandusky, where they're able to take back medications in a controlled environment, like from a nursing home
Right.
or things like that. And then those can be reused in other instances,
Right.
but for the general community, once it leaves, we can't verify any of the stability, sterility, has it been changed, altered, modified, so they have to be disposed of.
Unfortunately, a few bad, like a lot of things, a few bad people have probably messed that up.
Yes.
Changed that. You don't know that that's the medication in there. Of course, we would
Goes
hope
back
it
to
would
the
be, but you never know.
Tylenol,
Right.
probably 20 years ago.
Yes, you never know what's in there. So there are so many broad topics in pharmacy, but I also want to give a little bit of time to what if somebody is looking at a career in pharmacy? When people think about, well, I work in a hospital, well, then you have to be a doctor or a nurse. If I work in a pharmacy, I have to be a pharmacist, but there's all different kinds of things going on in pharmacy. Can you guys talk about your schooling or how you got to where you are?
Pharmacy is a great profession. I think anything in the healthcare profession is a great profession. It's not going to go away. When we look at the pharmacy, we now have 7 pharmacy schools in the state of Ohio to deal with the population growth that we continue to expect to see and the health needs of us as we get older. To become a pharmacist today, it's anywhere between a 6-year at the shortest to an 8-year program. Usually a 2 to 4 year pre-professional division and then 4-year professional to get your doctorate in pharmacy, which enables you to set for the national licensing exam, and then you're able to take the exam for pharmacy in any state in the United States. Pharmacy is very broad. What pharmacists do is they'll verify and approve and dispense medications. They now administer vaccines. They provide education to the patients. They provide education to the other healthcare members and the team. We are involved in hospital and retail and long-term care. We're in chemotherapy. We're in nuclear medicine. So pharmacists are involved in sales with pharmaceutical companies and research. So there are a vast opportunity of healthcare jobs within one's career to change and shift gears if so desired. So from the pharmacist side, I think there's a lot of rewarding opportunities for those that are out there. And I'll let Jackie talk about those.
With technicians, schooling is not mandated yet in Ohio, but it is going to become mandated. You just go, there are several certificate programs offered, and then upon completion of those, you're able to sit for a national certification exam. And those are the steps that you would take to be a tech.
So it's all schooling and some tests.
It is because we're getting involved more as a team approach, and in healthcare, pharmacists are becoming more involved in the clinical aspect because there have been drug shortages. Of course, everybody's trying to be careful of money and costs, so the pharmacists are a valuable team member where they can direct a good therapy to choose
Okay.
or what
questions
avenue
to-
to go down.
And I like you both mentioned like, the team approach that, you know, when you do a care conference for a patient that, you know, you guys call the doctor's offices all the time, and the doctor's offices call you, and you talk to specialists and you talk to family doctors and probably dietitians and everybody in between, that
Yep.
it really is a team approach, and the pharmacist is a key person on that team.
And the human body is a very complex organism. And I think it takes the dietitian, the physical therapist, the pharmacist, the nurse, the physician, all of that, because there's so much interplay going on that any one person focuses on where their specialty is.
Right.
And when everybody focuses on their own but also relates to the others, that's when we get our best outcomes.
Right. Awesome. Thank you.
Thank you.
All right, we're going to take another break and we'll be right back. And we're back. I want to thank John and Jackie for being our guests today on the show, talking about pharmacy, pharmaceuticals. It reminds me that they are like a lot of things in life. Medications can be so helpful, but you have to be very careful because they can also be harmful if you're not seeking the advice of your pharmacist or your physician, nurse, everybody. It's just such a broad topic, even interesting in terms of career. There's a lot of stuff out there. We do have a retail pharmacy at Magruder Hospital. I'm going to make a shameless commercial. It is in the urgent care building of the hospital. If you drive past the ER, it's in that next building on the end. You have drive-through delivery if needed. Just a fantastic group of people really looking at your medications and how they're working together. There's apps for reordering. There's all kinds of fancy stuff. Their phone number is 419-732-4009. So if you have questions about something you heard about today, certainly ask your doctor, but if you also want, you can also call and ask the pharmacist. So thank you again for being our guests. If you ever have feedback about a program or a suggestion for a future episode, please let us know by sending a note to Time for Health, 615 Fulton Street, Port Clinton, Ohio, 43452, or you can email Mrs. Pelz at the high school, cpelz@pccsd-k12.net. So think about all the things that we talked about today, flu shots and keeping a med list and how you store your medications. It's helpful information for you and probably for people you know and love. And until we meet again, I encourage you to make time for health.